I've seen tiny babies cause absolute chaos during a birth, and I've seen 10-pound babies slide out like butter. So if you're being told your baby is too big, let's talk about what that actually means. From inaccurate ultrasounds to a fear of shoulder dystocia and pressure to induce, let's talk about when size actually matters and what helps labor go smoothly. My name is Jamie. I'm a midwife. I've been attending births for over a decade. If you're new here, let me know in the comments how far along you are. So what counts as a big baby? When a provider uses the term big baby, they're often referring to babies over 8 pounds and 13 ounces. Some providers act like a 9-pound baby is a medical emergency. Meanwhile, half the grandmas in America are talking about how they birth 10-pound babies with no problem. And midwives, some of the easiest births I've attended are those big babies. You know who the main culprit is in all the big baby hype? It's often those third trimester ultrasounds. And guess what? They're not always accurate. I'm going to tell you a story of a perfect example of this. When I was a student midwife, I got a call from a mom who was 36 weeks pregnant. I had never met this woman, and at that time, I was not practicing actively as a doula, but when she explained her situation, I was all too eager to help. Why? Because at her 36-week prenatal appointment, her doctor decided to do a growth scan and told her her baby was measuring 9 pounds, 15 ounces. Go ahead and just say 10 pounds, doc. Based on these findings, the doctor wanted to schedule a C-section at 38 weeks because they were questioning the mom's ability to birth this baby. This mom explained to me that her first baby was born 9 pounds at 39 weeks and she had no issues with that delivery, so obviously she felt confident she could birth this one as well. Girl, say less, I got your back. One day, I get a text that her water broke. So a couple hours later, I meet her at the hospital where she's already started having regular, consistent contractions. Due to it being the weekend, her regular provider was off call and they had lost her records. And I believe that's the only reason she was allowed to labor. This woman went on to vaginally deliver her baby like a champion. Now, how big was this baby 2 weeks after being told it was 10 pounds? Less than 9.5 pounds. Still an impressive sized baby, but if you consider that babies put on average a half a pound a week towards the end of pregnancy, that baby was likely a little over 8 pounds during that initial ultrasound. Late pregnancy ultrasounds can be off by 1 to 2 pounds, and bigger babies are often overestimated. I cannot tell you how many women were told they had a giant baby only to deliver a completely average-sized newborn. Estimating fetal weight in the third trimester is often difficult because you can only see a small portion of the baby. Because of that, providers are making decisions based on imperfect information. So, what are providers actually worried about? Mostly shoulder dystocias, aka babies getting stuck, but also severe tearing, long labors, and potentially a C-section. The truth is, shoulder dystocias can actually happen with any size baby. But the issue isn't just big baby, it's whether or not the baby can fit through the pelvis safely. That means the baby's position matters, as well as movement and mobility in labor. By the way, if you find this type of content helpful, let me know by hitting like or hit subscribe to follow along. Big babies should not be an automatic C-section. Look, I've seen a woman birth an 11.5-pound baby in 2 pushes after a 3-hour labor. Obviously, a woman's pelvis needs to be part of the equation. They are not fixed bones and they're mobile. Unnecessary fear, such as big baby stress, can cause women to tense up during contractions, and a tight pelvic floor is hard for a baby of any size to navigate. A lot of people imagine birth to be like shoving a watermelon through a drinking straw. That is not how this works, but sometimes size does matter. Gestational diabetes can cause larger babies. Now, these larger babies aren't based on genetics and often have additional fat and may cause trouble navigating the pelvis. Also, providers may be worried if there's a history of shoulder dystocia. Look, I've had a mom or two that I've risked out of future home births because of some pretty dicey births and anatomy. And sometimes there really is cephalopelvic disproportion, which means the baby is just too big to fit through a pelvis. Not very common, but it does happen. I was once at a labor where a mom's body was actively trying to push a baby out with all of its strength, but this baby wouldn't budge. This situation was a true CPD, and this mom delivered a 9.5-pound linebacker by C-section. All right, so what actually helps delivery when it's a suspected big baby? First, upright positions and staying mobile in labor. Avoid coached pushing too early and change positions while pushing. And most importantly, an experienced support team. A big baby is not automatically a dangerous birth, and a small baby is not automatically an easy one. Birth is more complex than a single number on an ultrasound. Tell me your baby's birth weight below and let me know what they guessed the size was prior to birth.